We continue to follow developing news from state health officials. The Department of Public Health announcing yesterday a Hampshire County woman in her 60s is the first to die in the state from vaping-related illness.
The Centers for Disease Control and Prevention says vaping-associated lung injury deaths are higher among women and older people. Western Mass News reporter Caroline Powers is digging deeper into how vaping may cause different problems, Caroline, in women and men and people of different ages.
Beth and Chris, the CDC says the majority of vape-related injuries occur in men, but more deaths in women. Bay State Medical Center says that is something they are looking into as more vape-related health cases rise across the country.
One thing that's happened over the last 6 months is that we're more aware that vaping is a thing that can lead to substantial lung injury.
Dr. Mark Tidswell at Bay State Medical Center says vaping has become a necessary conversation with all of their patients.
One of the reasons that the number of cases is just ballooning is that physicians, nurses, people in healthcare are asking the question more often, do you vape? Traditionally, we asked, do you smoke, do you drink, etc.
As of October 1st, more than 1,000 lung injury cases associated with the use of vaping products or e-cigarettes have been reported to the CDC from 48 states and 1 U.S. territory. On Monday, state health officials announced the first vaping-related death in the state, bringing the total number of deaths across the country to 19. The CDC says more vaping-associated deaths have been reported in women, while more men have suffered vaping-related injury. Dr. Tidswell tells Western Mass News it's still too early to explain why.
Right now, I think 2/3 of the people who have been affected by the illness are men, and 2/3 are between 18 and 34, roughly. There was this report that older women seem to be more likely to die from this. I think it's probably too early to say that that's definitely a risk factor. It may affect older people more than younger people. It doesn't mean it's safe for one group or more harmful for the other, but generally, I think we're at a point where we don't really know who it affects with such small numbers involved.
Dr. Tidswell tells Western Mass News that in the last month, he's heard of 3 vaping-related cases here at the hospital. Live in Springfield, I'm Caroline Powers for Western Mass News.